Thank you for tuning in to the Critical Conversations podcast, brought to you by Mind the Frontline. Established in 2023 as a 501c3, Mind the Frontline is your ally in the journey to support those who selflessly safeguard our communities. Their core mission revolves around pioneering innovation and research, education, and overall well-being specifically tailored to healthcare, military, and public service frontline first responders. The Critical Conversation podcast is a dedicated space for police, fire, EMS, allied health workers, dispatchers, air medical, and military personnel, along with their families. Here, we dive into the heart of the matter, tackling essential topics such as mental health strategies, recovery methods, treatment options, the latest research, and professional development opportunities. Before we dive into today's episode on Critical Conversations, we do want to, however, acknowledge the nature of our discussions. Some of the content discussed may be triggering or intense as we explore the challenges and the triumphs within the first responder community. We recognize that these discussions may evoke strong emotions or memories. If you or someone you know is struggling and needs immediate support, we urge you to reach out to your agency's mental health resources or your local peer support group. In time of mental health crisis, you can always contact the National Suicide Prevention Lifeline by phone or via text at 988. Please remember you are never alone and help is always available. At Mind the Frontline, we are more than just a podcast. We are a community committed to fostering resilience within the entire first responder family. So whether you're on the front lines or supporting those who are, we invite you to subscribe, engage, and be a part of this vital mission. To learn more, please visit us at www.mindthefrontline.org. Now let's dive into today's critical conversation. Welcome, heroes and advocates, to another episode of Critical Conversations by Mind the Frontline, the podcast that stands at the forefront of first responder mental health, wellness, and recovery. I'm your host, Chris Smetana, a former firefighter and flight paramedic and president of Mind the Frontline. And I'm thrilled to have you join us today's episode on mind, meds, and mushrooms, decoding the treatment choices for first responder depression, talking about the treatment options for depression among first responders. So, we have an incredible episode lined up for you today, featuring a fellow first responder who firsthand has actually gone through some of these treatments in his own recovery and struggles with depression. And he's on joining us today. Our guest is critical care paramedic Bryan Tucker with over 20 years of EMS experience. He's currently practicing as an EMS education director who has personally gone through these struggles with depression and has tried various treatment options in his recovery. So let's jump into today's episode, have some mindful discussion on the treatment options for depression. Welcome, Bryan, to today's show. Thank you very much for making the time to join us.
Hey, Chris, thank you for having me today. I really appreciate it. This is an important topic to me. It means a lot for myself, having gone through a lot of this stuff, and also several friends that I've had that have gone through this as well. So thank you for having us today.
Yeah, absolutely, man. Thank you so much for making the time. You know, as we were kind of preparing for today's episode, it was really kind of, we had some really good conversation over the phone, you know, and I loved how we kind of came up with the show title when we're talking about, just mind, meds, and mushrooms. You know, I was like, oh, wow, I'm really going to get to talk about this today. It kind of feels like a little bit like a faux pas, but I'm already kind of recognizing like it's because there's a stigma, there's a stigma about this stuff.
Sure.
But no, it's it's exciting. It's something that we need to talk about because as medical treatments are continually changing, especially among first responders in the treatment of mental health and wellness issues, we have to look at everything that's out there. And I really like today's episode and what we're going to dive into. We're going to be talking about everything from, SSRIs to depression to inpatient, outpatient therapy, ketamine therapy, psilocybin therapy, you name it. We're going to kind of talk about it and hit on those kind of high points during today's episode, which brings me to my first kind of point, exploring the therapeutic approaches, and trying to figure out what works best for first responder depression. At least in my experience, and I don't know about you, Bryan, I'd love to hear your experience, but, I've learned over the last 5 years of my recovery that, it's not just one thing that kind of works. I've tried several facets in my recovery, and sometimes that's dynamic. It changes sometimes month to month, sometimes, biannually, semi-annually. It just depends on the way things are going. What do you think, when it comes to first responders with depression, like what's the first thing that comes to your mind?
Unfortunately, the first thing that comes to my mind when I think about first responders who are suffering from depression is the fact that a lot of times it's just part of our personality, I think, that attracts us to EMS. We don't like to talk about it a lot. We don't like to necessarily share that with people because, like you said, there is a stigma attached to mental health and first responders and us seeking help for our mental health difficulties. So personally, I've known 3 people who have unfortunately ended their life because of struggles with depression and PTSD in this field before in EMS. And I hate that. I hate that a lot of people don't seek the help that they need because of the stigmas that are attached to it. So I want to use this episode today to kind of inform people of what kind of treatment options are out there, what those look like, and what's available to them, and let them know that it's okay to seek help. It's a good thing to seek help. We need to do that, take care of our mental health. It's just as important as taking care of our physical health.
Yeah, I think you couldn't have said that any better, Brian. I've lost a countless number of friends, not only just this year. Last year was really bad for me. And these are just numbers that we're hearing about, right? There's a lot more numbers out there that we're just not getting, whether it be police, fire, hospital. We're just not seeing the totality of the picture and how much depression really kind of leads into those numbers to the struggle and battles of depression, PTSD, and everything that kind of comes along with that. At least for me, when we talk about some of these initial treatments, I want to kind of hit a little bit on cognitive behavioral therapy and EMDR in this kind of first topic, and really kind of talk a little bit about that. Do you have any experience with either one of those? And if so, kind of what has that kind of done for you in kind of your depression?
A little bit. So I've sought therapy through multiple different facets. And there was one particular therapist that was using kind of an EMDR type approach to the therapy. And I did find that helpful. But like you said earlier, there's not just one avenue towards effective mental health treatment. There's several. And a lot of times you have to use them together to find an effective treatment that's going to work for you. And not everybody's the same. Some people, these kind of therapies work great for. I've heard some really good success stories. And people like in my situation, I had to seek out, some extra therapies to go with this in order to make it effective. But my experience with it is a little bit limited. On that particular topic. Do you have some experience with that, or?
Yeah, absolutely. I did try EMDR. I did it early on in my recovery. And for our viewers and listeners, I would encourage you to go back to episode 1 of the Critical Conversations podcast. Me and Dr. Tanya Glenn kind of talked and touched on this, and I definitely want to do a deep dive and give it its own episode in a future episode. But we kind of talked a little bit about, how early on, EMDR can really, really help with preventing PTSD from occurring, or PTSI. When we're still in that phase of post-traumatic stress syndrome just meaning, hey, this is a normal, natural response to the stress stimulus and trauma that we just witnessed, experienced, whatever. If it's sticking with you after a call, that is, a really good time early on, especially in crisis. If it, hasn't left you after a few days to, a week or so, to really try to encourage those individuals to get in and maybe seek EMDR as an early intervention to help with that PTSS from switching over to PTSD, because we don't want that. Obviously, we're trying to prevent that from occurring. So we do have, a window of time that studies have shown that, using some of these therapies are going to be very beneficial to not only preventing PTSD from really setting in with that instance, but more or less just giving that individual the tools to process that and put it away. When we talk about cognitive behavioral therapy, a lot of the studies suggest that, it's kind of tailored to those therapeutic interventions that kind of address the stress and the trauma. It really looks at addressing the root cause of the problem, not necessarily everything else. And so, I kind of agree with you. It's a tool and an adjunct to be utilized with probably some other tools, whether it be pharmacology, therapy, counseling, things like that we'll get into later on in this episode. When I look at EMDR, which I did early on, I didn't have a great experience initially. And I kind of want to preface this because, yes, the studies do show that it works. So please don't just say, hey, I'm going to take Chris's experience and not go try this. But I also feel like it's important to be really transparent on what first responders might run into should they decide to go in and seek therapy, especially for the first time. Because that's where I was when I sought this therapy out. I was in crisis. I had gone to a few different counselors, and it takes time. This is why I always encourage individuals to please go out there and try to find a therapist that works best for you, so you have someone to fall back on when you finally hit that wall, or you get in that crisis mode. Because when you get in that crisis mode, you're kind of scrambling. So if you don't have these tools and resources already kind of set up in the background, it could really be a detriment and a challenge for that individual to really get ahead. But with my EMDR experience, I would implore people to do their research on their therapist and make sure that they really do understand it. Where did they learn it? How often do they practice it? Because unfortunately, in my first experience with the EMDR, it was with a therapist who had probably, she didn't say it in so many words, but basically kind of went to a conference or a convention and basically got her EMDR certificate, and then she had come back, and I was actually the first patient that she tried it on. It did not go as smooth as I think either one of us had wanted it. And I ended up seeking another provider afterwards because of it. I was very triggered. And that is something that you need to be aware of, especially if you're going into EMDR for the first time. And this might be a new provider that you're seeing. But when you look at EMDR, it was developed by a psychologist, Francine Shapiro, back in 1980. But basically it was looking at like the eye movement, desensitization. I cannot say that this morning. Holy cow. Thank you, Bryan, for helping me out. When we talk about eye movement desensitization and reprocessing, that's what EMDR is. It's cognitively designed to alleviate the stress associated with some of these traumatic experiences or that traumatic event that occurred. It involves attention to kind of three different kind of facets of it when we talk about it. And they look at the different time periods. We're looking at the past, we're looking at the present, and the future. And the focus is given to the past for anything that's disturbing, any related events, but it's also given to the current situations that we're in that are arising that cause this distress. And then that allows us to develop these skills and the attitude and reactions and just the tools that we need for any possible future reactions. So, when it comes to EMDR, my first session wasn't so great, but in follow-up sequences with another provider, I did get to a really kind of a better place, in conjunction with all the other therapies that I was using.
Yeah, so I had kind of a similar experience. When I first sought out this therapist, I didn't know anything about EMDR. After we got to know each other a little bit after a few sessions, she brought it up and was kind of, like I said, very similar. I think it was not somebody that was very experienced in it. And I did find it initially very triggering. There was a lot of stuff, a lot of traumatic experiences from my past that were being brought up and discussed that did not feel real comfortable at first. However, as it progressed and time went forward, even though I don't feel like that particular provider had a lot of experience, I ultimately did find it helpful to kind of process some of those events that I had been through. So overall, it was a positive experience. But my quest for mental health kind of resumed from there, and there's definitely been some other options that I've sought out and tried too. So,
Yeah, and that would be something encouraging to anybody that's listening or watching, today's episode, is really just kind of what works for you. If it doesn't work, well, hey, you tried it, you can kind of move on, try looking at using it, in conjunction with other therapies. But absolutely, I think, doing your homework beforehand, having a really good, thoughtful conversation with the therapist or the counselor that's about to perform the EMDR on you, and really kind of understanding what you're going to walk into, and more importantly, what to do afterwards. Because I will agree with you. It's very, very uncomfortable to kind of sit in that kind of shit, I'll say, especially as it's all getting stirred up and coming back all at once sometimes. And so really kind of having an understanding of what you might be experiencing, what you might be, what you will potentially be triggered, and how to kind of work through that, especially after you leave, going home and journaling, going for a walk outdoors in nature. These are all things I would highly recommend. I wouldn't just, leave my EMDR session and just jump on social media or, go right back to a high stress job. I would try to use that time afterwards as well, which is equally as important as the preparation, to really kind of process and really think back about kind of what you went through, and that way you can kind of learn from those experiences and continue to take them forward in your recovery.
Absolutely. Yeah.
Well, let's talk about medications, right? Because, when we talk about depression, I would say that most commonly, a lot of the people who are suffering from depression, more than likely, at least from the statistics, are going to be probably placed on an SSRI or an SNRI. When we talk about that, a significant, instance of first responders suffering from depression can benefit from these antidepressant medications. But I also think it's important to talk about, really quickly, kind of what they do, what are those drugs, so we can kind of tie and correlate to those, and just what are some of the side effects that someone may or may not be aware of, when they go through and they start SSRI or SNRI treatment. At least for me, I know I went through some significant changes early on, when I was getting my dosages kind of tailored. What are in your experience? Are you currently using any SSRIs or SNRIs? And, what are your thoughts? And tell us a little bit about kind of how that helped and aided you in your recovery.
Sure. So I started taking SSRIs many years ago. I have been prescribed many of them. I've been on most of the ones that you've seen on the TV commercials. I've probably tried before. From Cymbalta to Celexa to Zoloft, Prozac, whatever. I've taken a whole lot of them. And initially, my experience with them wasn't great. I experienced a lot of side effects. And so I would go in after about 4 to 6 weeks of being on a dose regimen, and then I would express to them, hey, my depression's still bad, and I'm also experiencing side effects. And the most common response I would get would be, well, let's up the dose.
Yeah, right. It's always like, hey, we'll just throw more at you because it's clearly not working.
It's not working, so let's take more.
Yeah.
The higher the dose got, I found that in some instances my depression improved a little bit, but my anxiety would get worse. And that was one of the side effects for me. Now, there's a lot of different side effects, and people all experience different things. For me, I was having a lot of issues with anxiety, which I hadn't really had until I started taking the SSRIs. And it was really difficult for me to express that, or maybe to articulate it to the physicians that, hey, it's making me feel a little bit weird. And there were some other side effects that I was having too, anything from weight gain to weight loss, and sexual side effects and things like that, depending on the medication. And it was really kind of a journey for me over the years. I've currently am taking 2 that I feel like work for me. And it was like you kind of said earlier, it's trial and error. You're going to go through periods where you try a medication and maybe it doesn't work for you. Don't be discouraged. Continue to look for other options. There's a lot of medications out there. The one that ended up working for me really well is one called Vibrant. That one, for whatever reason, that was the sweet spot. It worked pretty good for my depression, at least for a while. And that was another thing I experienced. There's a lot of up and downs too, even on the SSRIs. You'll feel better for a while, and that doesn't mean that you can't. The depression's not going to come back. It can,
Yeah.
and you might be good for 6 months, and then all of a sudden, whether something happens in your personal life or at work or whatever, situational stuff can kind of trigger. Everyone has different triggers for depression, and things can trigger you and kind of put you back in that slump. And unfortunately, a lot of people, when they kind of hit that slump, maybe they've been doing good for 6 months or a year, but that's when they kind of tend to give up and say, man, this just doesn't work. And I hate hearing that. I've actually dealt with that with some of my family members too, that have struggled with depression, where I say, how's that going? How's that medication going? Oh, I quit taking it. Wasn't working for me. Oh, come on. Don't stop. Don't give up.
I think that's something common that I do hear from other people that do take an SSRI. First, when we think about, what is an SSRI? So we got a selective serotonin reuptake inhibitor, SSRI, right? It's the most commonly prescribed antidepressant class, but you can see a lot of side effects from this. I think it's also important to note, a lot of people who are struggling in crisis, anxiety, depression, they're hoping for a quick fix, right? Like turning on the light, something's going to make something all of a sudden better. And when it comes to SSRIs, it can take anywhere from weeks to months to kind of balance those out and really have the effects, the positive effects really kind of shine through and start taking hold. And that comes through trial and error. Like you mentioned, there's going to be times where you're going to have to keep going in, adjusting doses, trying to find that sweet spot. And it may not even be that medication. You might have to switch and then get on another med. And then that takes, typically they'll wean you off one and bring you on another. So that way you're not just kind of out to dry. You never want to stop cold turkey taking any SSRI. That could definitely lead to some negative effects, at least in my experience.
Absolutely.
Because what I do see is sometimes people, especially maybe early on when they kind of hit that kind of high, things are kind of working, they're feeling good. They're like, oh, I don't need these meds anymore. Or they forget to refill them because, that's me, I forget to refill them. And next thing I know, I'm like, I'm fine. And then, day 5 or 7 goes by and I'm a little bit more irritable. I'm not feeling so great. The sky's a little bit darker. However you want to kind of, feel like the storm's coming back in. And I'm like, well, what's going on? Like, why do I feel like this? Oh, yeah, because I stopped taking my meds. So I highly encourage, if you are under the care of a physician and taking an antidepressant, don't just cold turkey and stop. Whether you feel like it's working or not working, you never just want to stop that. That is going to, bring in some more negative side effects and potentially, increase the level of depression to the point where it can be, a really serious incident. Let's talk a little bit about some of the side effects that you hit on, because I think some of the ones that you had, I also share. I want to talk about a little of them. I'll hit the high ones real quick. Nausea, vomiting, diarrhea, dizziness, dry mouth, things like that, insomnia, nervousness, agitation, your anxiety, like you had mentioned. But the sexual dysfunction, I think that for me was something new. I was kind of struggling, like, why am I not able to get an erection? I'm going to be honest, it just, where is my sex drive, my libido? It just kind of fell off. That was something. And here's the thing, it came back. Okay. So not like it just disappeared, but there were some things that I wasn't aware of when I first started taking antidepressants, specifically SSRIs, that, if I would have known, I'd be like, okay, well, this is just a side effect that, I'm gonna have to work through this and work with my, my physician.
Yeah. I also have experienced that with different medications, which was a real bummer for me and my wife.
I'd say.
And also, it's something that's hard to talk about. When your doc asks you, "Hey, how you doing? Are you having any side effects?" It can be embarrassing to bring something like that up. And in the moment, obviously, it can be very embarrassing, and it can, in a way, it can affect your mental health even more than it's helping. When you have particular side effects that are occurring, it can be so uncomfortable, embarrassing, that you don't you don't want to continue the treatment.
I almost stopped taking it because of that, because it was embarrassing, man. I was like, I can't even I didn't want to even try to arouse my wife or flirt with her, or, you know what I mean? Like it became something where if I just kind of just avoided it and she didn't know, because then you're right. It plays on your mental health a little bit, because now you feel demasculated as a man. I can't speak from a female's perspective. So would love to hear some of your thoughts in the comments for any of our viewers or listeners. But it is something, at least for me, it challenged me, and I almost wanted to stop, and I didn't. I had to kind of work through it, and I eventually had to have that conversation with my physician and kind of say, hey, look, this is really negatively impacting my sex life and my ability to connect with my wife, which also is part of my recovery, that connection, that human connection, feeling secure and love, all of that, and obviously sometimes we're trying to repair relationships because our depression has impacted that across our marriage and other personal relationships, friends, family, things like that. So, having that fortitude, and now hopefully having that understanding, if you're listening or viewing this or watching this, it is a side effect, but it is something that if you notice it, if you work with your physician, maybe there's a better drug that might work, another antidepressant, another SSRI, maybe we need to switch you to SNRI, there's things like that. But, having that conversation, which is often difficult to do, that's kind of where it starts, right?
Right. Absolutely. And it's usually as simple as just switching to another med. In my case, that was all it was just that particular med affected me in that way. And so we ultimately, when I finally got to where I could talk about it with my physician, we just switched to a different medication, and then it was fine.
Yeah, I mean, I think for me, I was on Lexapro when I really kind of experienced some of those negative side effects. Once I switched over to Sertraline or Zoloft, a lot of that kind of went away. I still have times where it does kind of negatively affect, or I've noticed it, but not nearly as bad as when I was on Lexapro.
I believe Lexapro was the same medication that I had trouble with as well, actually.
Really? Okay.
Yeah.
Well, so there's some trends. If you guys like to connect with your significant other, maybe just be aware of that when your physician says, hey, we're going to put you on Lexapro. Maybe you could be like, well, I kind of enjoy connecting and making whoopee with my wife or my significant other. So let's talk a little bit about SNRIs. When we talk about SNRIs, what have you ever taken any of those, like Effexor, Cymbalta?
Cymbalta, I did.
Cymbalta, yeah, it's the most common. It's one of the most common antidepressants when you look at the studies. What physicians are describing for antidepressants. How's your experience been with that, with Cymbalta?
So my experience with Cymbalta was brief and honestly not very positive. And I hate to I don't want to discourage anyone from seeking out SSRIs. But just me personally, that particular one seemed to actually increase the intrusive thoughts and that really dark side of depression. I just personally had that sort of adverse reaction that a lot of people don't have to it for whatever reason I did. And I got off of it very quickly. I let my physician know, hey, this is what's going on. I'm having some really intrusive thoughts, and I feel like it's attributed to this medication that I'm on. And they switched me very quickly and got me to a different, back into SSRIs.
Back in SSRIs, yeah. They considered moving me over to that, but we wanted to try to make sure and see if Zoloft was going to work, and it ended up working. That and some Wellbutrin. That's kind of really all I needed, or I'm on right now. When we talk about serotonin and norepinephrine reuptake inhibitors, or SNRIs, for our viewers and watchers, just understand, this works by kind of inhibiting the reuptake of these chemicals. So your brain naturally secretes these, and then they get reuptaked, or they get reabsorbed, back into the synapses. But what we do when we take a SNRI or an SSRI, basically it blocks that reuptake. So there's just more serotonin and more norepinephrine kind of floating around in your brain to kind of really help, hopefully, with your mood, your anxiety, and your depression. And that's kind of how it's working. So it's not a bad thing. Sometimes I see people with SSRIs and on an SNRI. Sometimes some patients work better on an SNRI than they do an SSRI. once again, this is trial and error, and every first responder, every provider, every person that's seeking treatment and recovery is going to be just a little bit different. But that kind of brings me to my next one and our next topic, which is ketamine. I love ketamine. Can I just say that?
Me too.
I think both of us have tried Spravato or are currently doing Spravato, but when it came to ketamine therapy, this was about 2 years ago that I started it, but it was kind of new. It was kind of catching streams. A lot of the research was starting to come out to show the support of it, and Esketamine, infusion therapy, things like that. And so once again, I wanted to try. I wanted to see if I could add this treatment modality to my toolbox to continue to help me with my recovery. And I'll share a little bit about my experience, but I kind of wanted to let you kind of dive in a little bit on Esketamine and your kind of thoughts and kind of, how did you like it? What did you experience with it? What made you decide to go with it?
Yeah. So for me, I got to a point where I was taking all these SSRIs and anti-anxiety medications, and my depression just became crippling. Truly almost paralyzing. I got to the point where I didn't want to go to work. I didn't want to do the things that I normally do for fun, the things that I enjoyed doing. I've played guitar for 30 years. That's one of my big hobbies. And I just stopped playing, wasn't engaging with my kids, my wife. I was just laying in bed all the time, sleeping a lot, really not doing a good job at work. And it was horrible. It was pure hell. And I sought out a new provider. And that particular provider said, okay, you've got treatment-resistant depression. How do you feel about trying ketamine? I said, let's do it. Absolutely. And I was a little skeptical at first, just because I've been through so many treatments and so many different types of things for depression that didn't work. I was very discouraged. But I started doing this Spravato, and initially you do it twice a week for the first 4 to 6 weeks. That's your kind of your first regimen, and then they sort of taper it off from there. And I noticed after about 2 weeks that my mood was improving. Things seemed a little, colors seemed a little brighter. Everything just seemed a little better. And it wasn't a profound difference that I noticed, but what was really profound was the difference that everybody else was noticing. My family, my wife, my friends, my coworkers, people were saying, man, it's night and day. You're...
Man, the old Bryan's back,
Yeah.
Hey,
so
where's he been?
What are you doing? What happened? And it's ketamine therapy. The way my wife put it, she said it was a miracle. Truly, because I've been through so many years of failed attempts at trying to treat the depression, and this was something that combined with an SSRI really brought me back to where I wanted to be.
And that's good. You kept advocating for yourself, and I could totally understand and relate to being guarded when starting a new treatment, right? Because, and that's part of the resiliency that we all gonna go through if you're experiencing depression, right? You have to be a very resilient person or build that resiliency, because there's going to be things that do take time. There's going to be treatments that may not work as well for you as they have others. And that's why I try to encourage people like, Bryan had a phenomenal ketamine experience. It doesn't mean just rush out and go grab, some ketamine and squirt it up your nose by any means. It means, hey, it worked for Bryan. What works for Bryan may not work for you. And so having that understanding when you start any new treatment, I think is par for the course, really.
Sure.
Some things work, some things don't, but I can understand, because obviously in order to qualify for esketamine or ketamine therapy, you have to be diagnosed with treatment-resistant depression, meaning that I've tried 3 SSRIs, 2 of them did not work. The third one is kind of working, and that's kind of the basis, at least they use for my pre-approval through my insurance. They wanted to make sure that, hey, had he tried all these other things? And yes, I have, and I still just don't feel the way I want to feel. I don't feel alive. I don't feel like I have purpose. I don't feel driven. There's a lot of those things that come with it. And so, you have to have that expectation starting any new therapy, but, the cool thing that came with ketamine, it came from the FDA, when they finally approved it March 5th of 2019, it was the first new medication for major depression in almost, it was in several decades actually. And so, everybody kind of, for ketamine therapy, what you will probably find in your Google search is just, treatment center after treatment center after treatment center of ketamine centers, right? Because now those are kind of popping up. And I think our viewers and listeners, especially if you're a first responder, you know who I am. And I always try to be transparent to set people up for, realistic expectations, something that's not unrealistic. And that realistic expectation is to understand that, there are businesses and there are corporations and enterprises out there looking to make money, and this is a way for them to make money. The reason why I say that is because, once again, like any therapist or any treatment that you're about ready to start, you really need to do your homework and find a provider that fits best for you. I've heard good stories and I've heard bad stories about people starting ketamine. I'll share my first experience because I think it's kind of a common experience, at least from people that I've spoken to in my circles. But I do see it becoming less and less as the ketamine clinics kind of really start understanding how to deliver this and what they need to do to support the ketamine therapy and the provider during those sessions. But for example, I found a good provider. She's a nurse. She specializes in psychiatric first responder trauma. So I built a relationship with that. That's where we started working on my SSRIs, my antidepressants through counseling and that. And then we slowly kind of progressed into ketamine therapy. No fault to this provider's at own, but it was still kind of new at the time 2 years ago. And this is pretty much right after I had gotten out from being institutionalized for 10 days for trying to commit suicide. And so I was, kind of grasping at straws and looking for that hopefully somewhat quick fix. But, I think when we're all in crisis or drowning, you're just looking to grab onto whatever you can. And I went into this, I had a really good discussion. They gave me the little trainer so I could practice like playing at my nose and squirting it, but nothing comes out. And really, my first session, I just didn't know what to expect when I walked in. And since the provider has improved because I gave them that feedback, which I love to see, if they take good feedback and make it better, then great. But the first time I went in, I had no expectations. I didn't know what to expect. I didn't know what I was supposed to do. I go into this kind of room with a nice lazy boy chair and some, sound and some color lights and, kind of made myself comfortable. They gave me a little bit of notepad so I can jot down ideas. And I'm like, okay. And then they came in and we started going through our doses. And for me, it was every 5 minutes, I would get an 81 milligram squirt, and alternate nostrils. Sometimes that doesn't go in all the way. Sometimes it gets caught up. Sometimes it would go right in and I would get hit immediately. But on this first one, I definitely felt like I had gone into that euphoric dissociative state, but I didn't know what I was supposed to be doing other than just kind of sitting there. And it's just because I just didn't do my homework, and this is on me, before I walked in there and did it. But when I walked out, I was kind of like, okay, well, now what do I do? And so feeling that, I had reached out to some other friends who I know had gone through some ketamine therapy and kind of asked them like, hey, what do you do? How do you do your sessions and how do you set yourself up? And they gave me some really good tips and tricks, and so I want to share just a little bit of what works best for me, or maybe some things you should consider. But, when you go into a ketamine therapy, at least for me, I try to, that is my day of therapy, so I try to make sure like I don't have too much going on. I'm not going to go back to work. I'm really just taking a day of self-care for me. And you do need to get in that mentality of just kind of letting things go if you can. I try to stay off social media. I try not to watch the news because it all just, kind of muddies the water, so to speak. And I really want to kind of have that selfward introspective, thought process when I walk in and kind of be present. And so, when I get in there now, sometimes I'll get my iPad, I'll bring my iPad with my AirPods and put them on, mute or, silence mode so I can really just kind of be there. And sometimes I'll just put on like just a soothing, healing jazz station or something like that, with some video or some nature scenery, things like that. And that kind of helps draw me into my euphoric state, right? So I feel somewhat connected. I feel at peace. I feel safe. And then, you just start having thoughts come to you and try not to like fight the thoughts. I just try to let them come, let them go, process what I can. I try to jot some things down if I have the ability to. And then really just, what I would do is I would do my ketamine sessions, which are 2 hours long, and you need to have a driver. But as soon as I would wrap that up, I would leave an hour window, but I would kind of go and either journal, write some things down, go for a walk. And then I would try to make an appointment and get in and see my actual therapist and start talking about some of the things that I had experienced, some of these thoughts that had come through, to really kind of put things in perspective or start organizing them in my brain. And then just kind of, having a nice chill day afterwards, that is what I have found works best for me. But it lasts, when people talk about ketamine therapy, you kind of get that relaxation and that anti-anxiety and not feeling so depressed it comes on pretty rapidly, I would think, within a day. I mean, for me, as soon as I left that session, I felt better. I was like, oh, I didn't know why, and like you mentioned, as time goes on, more and more people recognize like, oh, dude, Chris, man, what are you doing? Oh, I'm just doing ketamine therapy. I feel chill. I feel calm. I feel present, but with any other therapy, it only lasts for so many days, and it's about 2 weeks, and this is why, you look at maintenance doses and things like that. You start going twice a week for the first, 4 to 6 weeks, and then they slowly kind of wean you off to maybe once a week or every 2 weeks. And I got to the point where I was going, once a month, and that was all I needed to kind of do maintenance and kind of keep my things up. What are some things that you do, Bryan, like when you get yourself set up for ketamine?
It's funny. We have a very similar method. So I take my sound canceling headphones in there, and it's like you said, it's a nice dark room. They have a little salt lamp in mine and a recliner that you sit in, and I have them turn the fan on. I like there to be no noise whatsoever, in the room anyway. And I put my headphones on, and I kind of came of age in the 1990s, so that's what I listen to is my 90s music. And like you said, that kind of helps to bring up that sort of euphoric feeling that you get when you're on the ketamine, which I think is real. And that lasts for me for about 20 or 30 minutes during the session. And then the rest of it, it's just, you still feel very like your anxiety's kind of melted away, kind of refreshed, maybe still a little slightly out of it, but not like for that first 20 or 30 minutes. But that's where I think the real therapeutic part is in that first 20 or 30 minutes. And so I will also take some notes, a lot of thoughts that come to my head, things that I think about. I'll take notes and kind of write that down, jot that down. And then at the end of my session, my provider always comes in and we talk for about 10 minutes or so. And I'll bring some of those things up and we'll talk about it. And another thing that I really like to do is I'll share some of those thoughts with my wife. I'll just text her while I'm in there. They let you bring your phone. I don't recommend like watching YouTube videos or something like that. That's going to be really distracting. I think you really need, to have that time with your own thoughts and your feelings and yourself while you're in that therapeutic stage. But I will talk to my wife a little bit and just tell her what I'm talking or what I'm thinking of, what I'm feeling. And sometimes it's not always a positive thing. Sometimes I'll have some past experiences or something will kind of come to my mind while I'm in there, and I'll talk to her about it a little bit, and it just feels good to get it out, talk about it. But it sort of puts me in a state where I can, because a lot of times, especially in the past, prior to ketamine therapy, these thoughts would come into my head and I couldn't express them or articulate them the way I wanted to, or I didn't want to in the first place. And this has kind of opened me up a little bit and helped me to share some of my experience a little more with the people in my life that are important to me. But yeah, I definitely like to listen to some music, something that relaxes you, and turn your phone off, put it in airplane mode. Don't let work call you or anything else. You want to be You want to set
Don't
up
be
your
checking
appointment.
your emails. Don't be
Yeah.
checking social media. Like,
Exactly. None of that.
as you mentioned, you do need to be present to get the full benefit out of this. I would I brought my phone in all the time, and I would kind of do something similar, like where it's like, oh, a thought came and I had to like get it right back out. So I would text somebody or, do something like that. I learned later on, to kind of like start throttling those back, writing them on my piece of paper, kind of, sitting with that for just a minute. Because as you mentioned, you get the good and the bad, and some of the stuff I just didn't even realize I was unpacking or was an issue, but obviously it came to forefront. So, you start questioning that and start really looking and doing a deep dive. And you have to be open and vulnerable with yourself. To really get a lot of these benefits, you cannot lie to yourself. You cannot, you really do need to be honest. And I took accountability for some bad choices I had made, bad decisions, good decisions, all of that. The good, bad, and the ugly come in, but you also got to love yourself and be gentle because, if you're not, it could really kind of lead you down a path of, well, it does not necessarily with ketamine, but it could build up, and you really want to have a safe place to kind of offload some of that stuff and realize like, hey, this is my brain trying to get this out. And what I like best about ketamine is just the fact that when it does trigger your reactions in your cortex, it enables your brain connections and synapses to kind of regrow. You're kind of retraining your brain. And for me, the dissociative state I really like because that's when like the thoughts start kind of presenting themselves. They start coming front of mind. But as you're, like you mentioned, it only lasts about 30 to 45 minutes, about an hour and 15, hour and 20 minutes into the session, I'm starting to come out of it. I'm getting my wherewithal back. I'm really starting to process things. And that, I really enjoyed that time afterwards, just to kind of be present and really just think and be thoughtful and just journal and write a bunch of stuff down. I found that super helpful because then I would take that and then go sit outside if it's a nice sunny day, even on a bench and underneath a tree, go for a walk, do something to kind of reflect on it and then have good conversations, hopefully with my wife or whoever, that come out of that.
And I'd like to let people know too that it's not anything to be anxious about. It's a very gentle sort of euphoria. These aren't the doses that we're giving in the field for endotracheal intubation for RSI and things like that. It's you can experience some dissociative effect, but it's not a full disassociation like people hear about in the textbooks or like when we give it to people in the field.
You're not going to drop in the K-hole, people. You're not. Just trust me. There's not enough of that drug. I mean, not even to take me down. So, but I think that's a very good point because, maybe some people had injured themselves in the past. Maybe they're used to like morphine or fentanyl, when you get that warm, like, oh my God, and then you're just kind of out of it. Like you have no control. You do have a lot of control in ketamine therapy. Like it's not something that's just going to wipe you out or overcome you. It just leads you into that kind of warm, gentle state of just letting stuff go and letting it pass through you.
Yeah.
It's hard to explain, I guess. How would you explain it?
So I think after the first session, I told my wife, I said it was like morphine without the good part. That's kind of how it felt with me. It's a euphoric feeling, but not quite as intense as opiates. If you've ever been in the hospital and received like morphine or fentanyl or something like that, it's not quite to that level. It definitely reduces your anxiety for the most part. You feel a calming effect. And I wouldn't call it, it's maybe mildly dissociative, but you become very introspective and very aware of some stuff inside of your head that maybe you weren't or you're not when you're not on the drug. It is kind of hard. It is difficult to explain. You kind of just have to go do it and see what it does for you. But for me, that's kind of how it feels. And it's not a bad thing at all. I mean, it feels great. And I think that it really, truly does help with depression. And the great part is that it works so fast. Whereas the SSRIs can take, a month or two or even longer to build up in your system before they really start having an effect. And by that time, a lot of people have already decided, well, I don't want to do this anymore. It's not working.
Or they've given up,
They've given up,
yeah. And this is why I love it, man. It's once again, if you're listening to this, watching this, it's not just one thing that's to bring you out of this suck, this kind of endless, bottomless pit that you might feel like you're alone in, because I know what that pit feels like. I super, super uncomfortable. I don't like it. Now, and you mentioned that it comes in waves, but it's nice because ketamine does come on so quick, and it does last up to 7 to 14 days following your treatment, so it sticks around. And in conjunction with other therapies, like you mentioned, for me, having gone to therapy, in my sobriety, I work on a lot of personal things, like understanding resentment and things like that. And so when I'm in that ketamine state and I'm working through things, I can use, I guess for me, it sets the stage, right? It sets the stage for what I'm going to do, but I have to bring the actors or my tools or my toys with me in order to really kind of maximize that stage. And that means, I got to have some introspective, abilities. I got to be transparent and love myself. I got to be open with myself. And I have to have those tools. And I didn't have those tools early on, and I had to develop those. And so as I've continued to develop those, I've gotten more and more benefit out of each one of these therapy modalities.
Right. I think, and I want to stress that it's not a complicated thing. But it kind of allows you almost to become your own therapist in a way. You start to heal within your own mind, if that makes sense.
It does, 100%.
It really brings a lot of things to the forefront that you might not have seen or been aware of prior to that therapy. And so I really like it. I think that it works great for me personally anyway, and a few other people I know, you included, who have experienced that. It's really done some wonderful things for those people. So if you're out there and you're having trouble with depression and you're, depending on what modality you've tried, it's just not working, I highly recommend looking into Esketamine therapy. I think it's very, very effective.
Yeah. The hard part with esketamine therapy is typically if you have an insurance, they're going to want to look and say that you have treatment, resistant depression. And so if you are new, if you're in crisis, don't just think that you might be able to walk in and be a candidate for that. You absolutely can if you're paying out of pocket, but if you want insurance to cover it, which, is helpful sometimes, you just need to be aware of that you might need to try some other therapies first, and that's okay, but using that and, with counseling and EMDR and, getting on SSRI, whatever else, SNRI, it helps. So just be aware that you might not just be an immediate candidate right off the bat, but it is a treatment modality that should these other things, if they're not getting you to the place or the state that you want to be, then absolutely, look at other options out there, which brings me to my next option, cannabis for depression. Let's talk about weed. First, I'm going to be transparent and talk about weed. I have my own state of Utah medical card. I have it for high functioning anxiety, depression with suicidal ideations. I have CPTSD now, complex, because I'm just really complex, and that's okay. But for me, I had gotten cannabis, and I'll talk about kind of where the FDA and some of the science behind it, but I just wanted to kind of expose the viewers and listeners to why I utilize cannabis and medical cannabis. First, I have my card. I went and saw a physician. I did it legally. I go to a dispensary, but really two parts to that. Sometimes for me, like I have propranolol for my panic and anxiety attacks, right? And sometimes that just does not work. Sometimes going to a vape pen, I don't use gummies, but I've heard people use gummies. There's plenty of different opportunities or methods to take the THC. But for me, I would vape it. But that immediately could bring my anxiety down within 5 to 10 minutes, to a point where I could use my other resources and tools to get hopefully things under control. I also have used it, as I was waning or, removing alcohol from my daily routine. One thing I would highly encourage those who are suffering from depression and anxiety, just look at alcohol, because it is a big contributing factor to not getting ahead or making probably the progress that you want. So, but that's a decision for everybody to personally make. But the reason why I really kind of not enjoy, but like the opportunity and the option to use medical cannabis if I need it, is the fact that if I'm having a panic attack, I don't have to sit there and take, Valium or a benzo or something like that, which is really going to negatively impact me, my mentality, my mental state, to a degree. At least with cannabis, I don't get that super head high, things like that maybe people have experienced before or in high school. But for me, it's a nice steady way to kind of like ketamine in a different way, but it brings me back to that kind of chill state where I can slow my heart rate down. I can practice some box breathing, things like that. So it's just a tool and a resource. Have you heard of anybody, any other first responders trying medical cannabis for their depression or anxiety or mental health issues?
Absolutely, particularly in other states. Now, unfortunately, where I live, it's not legal. So if you live in one of the more conservative states, it might be a while before that happens. But I have friends and family that live in all over the United States and places where it is legal, both medically and recreationally. And I have known several people that have used it to treat anxiety and depression. And I can't speak for that myself as far as how it actually affects the depression, but I know that it affects the anxiety for sure. And some of my friends and colleagues that live in Colorado, Oklahoma, there's another one, Utah, several states that have it legal if you have a medical card, have reported to me some very, very positive outcomes from using the cannabis for their anxiety. And I know, like you said, I think there's several different types. You can smoke it, or you can vape it, or they have the edibles if you're not into smoking or putting things in your lungs. But I think that's a great option out there for people when it is legal. Obviously, if you're in a state where it's not legal, that's a choice you have to make. That's a risk.
It's a risk.
But I've definitely heard some positive things from the people using it medically.
I think as we find it more and more mainstream, amongst the general public, it's being more and more accepted, just like psilocybin mushrooms and some other alternative or holistic approaches to mental health and wellness treatment options. When it comes to the research, though, I do want to be transparent and honest. Like, it's still out. There really is. It's really hard to come back and say, does cannabis really affect at least depression, right? And this is kind of the main topic for today, so I'll stick with that. But there also have been retrospective studies and things like that do show there might be a benefit that does help with individuals utilizing medical cannabis or cannabis in general for their mental health and wellness routines, especially when it comes to depression. So, but when you also look at it, you have to understand that marijuana is a depressant in itself, so just recognize that. And, when you think about that, some people have reported, they get more anxious and they get, some kind of fear triggers, panicky, things like that. So it can have a negative effect, just like any drug. It may not be the drug for you, but I want to talk a little bit just real quick before we move on to the next medication or treatment modality. A lot of people ask me like, hey, Chris, I want to try cannabis. However, my department tests for it. Am I going to get in trouble? What have you experienced before I kind of share some of my experiences as far as first responders utilizing medical cannabis while still being employed for an employer who does drug tests and may look at, cannabis as being still a Schedule I illegal drug, which is being changed if you're not following the news. Come January 1, 2024, they're finally going to decriminalize it. So you should see it. It's kind of start spreading. But, have you heard of other first responders who are taking advantage or utilizing medical cannabis for their depression or anxiety while still kind of working and the challenges that they might have faced?
I have, but I'm not actually certain if their departments or their employers do test or not. So I'm not certain if they're just taking the risk and doing it anyway, or if, how that's going for them. But unfortunately, I have known at least one person who had to stop using it even though it was legal in their state, because their employer came out and said, hey, we're still testing for this. If you pop, that's an automatic termination.
Yeah.
So even if you're in a state where it's legal, that can still be the case. The employer can decide if they're going to have any disciplinary action towards,
if they're going to pursue it. Yeah. And that is a risk. I'll tell everyone, just to be transparent, to all the viewers and listeners out there, if you're thinking about using medical cannabis or cannabis in general, or already using it, it's a decision that you are going to need to make. It's just like, if you want to drive while intoxicated, if you pop a DUI, you're more than likely going to get terminated from your job. The same thing occurs here with cannabis. If you pop positive, they still look at it as a Schedule 1, illegal drug, and more than likely there's going to be consequences. And that's for each individual to weigh the risk versus the reward. I've heard people leaving a department or an agency to go to another one that was a little bit more lax, perhaps, and more supportive of holistic and alternative approaches to mental health medicine. So really, it's hard. And how do you have that discussion? Because I actually had someone bring this up to me last week. It's like, hey, I have my medical card. I use cannabis. I know it's a risk. And they're just fearful. Like I asked, like, hey, have you looked at your company's policies? What does it say? Have you thought about maybe approaching, senior leadership and having that discussion? And they're like, oh, hell no. Oh, hell no. I'm not going to say a damn word until I get popped, and then I'm going to try to fight it then and basically say, well, hey, look, I got my medical card. I've known people that have done that, and it did not turn out so well for them, and they ended up still losing their job anyways. But I don't have a good answer. Bryan, do you? I mean, how do you approach your agency or your employer, if you're using one of these alternative therapy methods that, may be accepted in the medical community, but not necessarily on paper?
That's always going to be rolling the dice. When you approach your employer and tell them, hey, I'm thinking about, or I am trying to use cannabis for mental health purposes or whatever you're using it for, that's certainly a scary thing to do, because you're not sure how they're going to react to that, whether it's legal in your state or not. And I think we're getting to a point, we're progressing to where it's going to eventually be decriminalized at a federal level. Once it reaches that point, I think the remaining states that still have it as completely illegal won't really have a leg to stand on at that point. If it's legal at a federal level, then you may as well decriminalize it at that point at the state level. But and I think as time passes, it's just going to become more and more accepted. In my opinion, it's certainly a better option than using alcohol. Alcohol
100%. I agree with that. It's funny. Yeah. And you look at the prevalence of alcohol in public safety, and there was just a news report this morning about, how it's an accepted culture at one of the local police departments here in Utah, and they're doing an investigative report. But I will tell you that alcohol is everywhere, whether you're in public safety or not public safety, but especially if you're in public safety, we use it at conferences, we use it after shift, we use it at parties, we get together. I mean, it is so used and so destructive, in my personal opinion, and this is just Chris's opinion, compared to when you think about, everything else. When you think about alcohol and comparing that to cannabis, man, at least for me, in my experience, it's been a night and day difference. Having alcohol and being a former alcoholic, or I'm always an alcoholic, alcohol is just it's a vice. It's like me grabbing heroin or me grabbing meth or grabbing coke. Like it's no different other than it's legal for some reason. But it really does, I've seen it destroy lives, marriages.
Absolutely.
When you look at the instances of, alcohol being in the system of individuals who have taken and succumbed to their battle with depression and mental health, it's very high. They do show that there is alcohol on board in a vast majority of these cases. And it's a catalyst, I would say, to negative, to continue to just hold you down underwater and hold you in that hell that you want to be free from.
Absolutely. If you're struggling with depression, I mean, I think the worst thing you can do is turn to alcohol.
But that's the first thing we do, right? Hey,
but you know
we think it's going to go away because I get drunk, I get buzzed, and now I don't have to care about anything anymore in that moment. But it's still there.
But it's legal,
comes back
and cheap in most cases, unless you're into really nice bourbons or something. But
I was,
yeah. I mean, it's readily available, unfortunately, and I don't agree with that. I hate that. I've had that experience myself. I'm a recovering alcoholic too, and many times in my life during my depression, I've turned to that, and it only made things worse, and almost destroyed my life several times. So, and I've seen it destroy a lot of other lives too. And of course, all of us first responders have seen that in the field many, countless times.
But we never think that we have the problem, and I'm not saying everybody does. Not everybody is there, but I will say that I feel like a lot of first responders use it as their initial go-to for depression. If they partake in alcohol, that's usually what they go to. They just increase the frequency, the majority, the amount, whatever look at it. So. We could have that discussion all day when it comes to alcohol and first responders and public safety, which is definitely an episode coming up in the future. So keep watching and keep listening. And don't forget to subscribe. Now's a good time to do that. But moving on, we got a couple more topics I want to hit on before we wrap up today's show. I want to talk about psilocybin mushrooms because this is starting to, like ketamine did, 3-4 years ago and is really kind of ramped up. You're starting to see the use of psilocybin mushrooms start growing as a holistic approach to depression. I will tell you, everybody here, that I have tried microdosing psilocybin mushrooms, and once again, it was a treatment and modality that I wanted to try and experience and see for myself, if it did aid. And because we're all looking to try to become the best person, the best version of ourselves, especially in recovery. And sometimes you don't know what you don't know until, you try something. Now, obviously, there was no legal authority for this. They're not legal in many states. There are very, very few states that are now being more progressive and legalizing psilocybin mushrooms. But what I am always drawn to, because, I used to be, or I still am, an EMS educator, is the science behind psilocybin mushrooms. And really, just like with ketamine, showing the regenerative growth of, taking a low dose. And this is not like your high school mushrooms, people. Like, you're not getting any sort of euphoria. You're not getting any buzz. Like, it has nothing to do with that. If you're doing that, you're doing it for the wrong reason. When you're microdosing, you don't feel or notice anything. It's just like taking a pill. It just, what I noticed after doing it for almost a month is, and I did this after my ketamine therapy, after I kind of weaned off of that, because I wanted to just see if there was another alternative out there, because, going to Spravato, it takes time, energy, money, things like that. And so I just wanted to see if there was another option out there and see if it worked. And I found a lot of similarities, at least in my experience with doing microdosing with psilocybin mushrooms in the recovery. Like, I noticed myself just having better days. Things were just not as heavy as they would. They weren't as scary, So I did get a lot of good therapy out of that. Now, because of the fear of being prosecuted for a Schedule I drug, I tried it. It worked, but I also felt like I had other treatment modalities that I could lean on that did not risk prison time potentially. So, I just abstained from it, after a few months. So, but it was the opportunity to kind of try it and really see if it worked for me. And I found, I found some clinical benefits. Now, the statistics, the studies all have wonderful things. I know Johns Hopkins Medicine released a recent study showing a large amount of decrease in depression, and the severity of that depression remained low, not only at 1 month, not only at 3 months, not only at 6 months, but more than 12 months after the treatment. So once again, like, we're looking for these things that will sustain themselves. So I don't have to take a pill every day. right? That's ultimately what I'm trying to get to. Like I'm never going to get to that point, but you know, we talk about ketamine. Yeah, ketamine works great, but it is going to wean off within 2 weeks. And you're talking about psilocybin mushrooms, like the effects and the after effects and the regenerative growth and all of that stuff, the presence of mind, all of that good happiness that kind of comes with it. You know, it's crazy to see how long it can actually impact you beyond the actual treatment itself. You know, we're so used to like giving morphine or fentanyl, it's hard on, hard off, kind of thing. And this is something that just goes on in the background for months.
Yeah. Again, not legal here where I live. So for me personally, it's something that I avoid just to avoid getting into legal trouble. However, I have known plenty of people now, besides I've had some experiences in my youth, but that was a little different for microdosing. But I do know some people that use psilocybin and microdoses, and I'm not sure how the dosing works, if it's in grams or milligrams or what it is, but I know that it's very small amounts that they take, and they're not actually hallucinating or anything like that.
No.
I don't think it's anything to be scared of. And some of the studies I've read said that they were pretty small doses that they were giving people. I can't remember if it was once or if it was a series of doses. But I know that it raises glutamate levels in the brain.
It does, which is exactly what ketamine does, right?
Yeah, it's the same thing ketamine does, yeah. Only, like you said, the effects last longer than ketamine. So I'm certainly not an expert in that field, but I have heard some pretty positive things from the people I know that have tried it. As far as its efficacy against depression, which is, that's what we're talking about today. And again, I feel like, if it's something that we have the science behind it to back it, this is effective, this is working. We're not talking about people dropping huge amounts of mushrooms and getting plastered or anything like that. I think under the supervision of a physician, it's something that is very promising. And I hope that they're able to find a way before too long to use psilocybin in a legal way to help people with depression. I have read a lot of great things about it.
100%. I really do hope that in the future they make this more accessible and not, obviously I've used ketamine, but ketamine, you have to be under the guise of a nurse or a health aide, that monitors your progress through the, esketamine treatment or, ketamine treatment in general. Whereas microdosing, because it's just a pill, you usually just put in a little pill cap. That's why you don't have all the you don't get that euphoria. You don't get that hypertension or the threat of that, which is also what they're monitoring for when you take ketamine therapy. You don't get some of those side effects and you get a lot more of the benefits. But here's the problem, and you can grow it in fungus and people want to charge money and make money. And so, I do think it'll take a little bit of time, but I am very encouraged by not only the data coming up, but my own personal experiences using it, and I can say, at least for me, it made an impact, a profound impact in my healing and recovery, especially in conjunction with SSRI and counseling and journaling. And the next topic that we're going to talk about, which is holistic healing. We got to talk about other things. And I think this is funny because the first time I started thinking about this when I was early on in my recovery, still struggling from major depression and suicidal thoughts and things like that. But yoga, acupuncture, meditation, journaling, some of these other holistic approaches that we just don't think of, or at the time when I thought about them, I'll be honest, like I put a stigma on them, like, oh yeah, I'm too cool for that. I don't, But now I love yoga. One, it really helps my back, but two, just kind of, it's that mental presence, I think that we talk about, whether you're in ketamine therapy or things like that. Do you have any, do you do any holistic healing, or have you integrated any of that into your recovery process, Bryan?
I haven't done any yoga. Not that I'm opposed to it. I just haven't ever tried it. But yeah, exercise is always great for fighting depression. Any kind of physical activity. For me personally, I like to sit outside in nature, walk around, Me and my family, we commonly build fires in our fire pit when it's seasonably acceptable. And
Nothing like a good fire pit, man, and a good
and
fire.
just sitting around the fire and being outside in nature and that kind of thing, just getting some fresh air, I think that really helps a lot. Putting yourself into a very positive environment in general, and again, the physical activity is proven. It helps with depression. It fights depression. And it's very effective. So it's something that I feel like in combination with other treatments can really help quite a bit.
Yeah, getting outside, man, especially when I'm getting some sunshine on me, like, and that's what I do. I have hard winters here in Salt Lake, because of, we get the inversion, we get clouds, you don't get to see the sun so much. I don't get to go outside as much. And for me, that really does. I love being outside in nature, camping, outdoors, smelling the pine, whatever that might be. And when I was watching a documentary last week, one of the newer ones that came out with the Dalai Lama, and they were looking at this neuroscientist from Berkeley, and she's, the studies are there. They show that by, like you mentioned, by just being outside in nature and present, I mean, that means not distracted on your phone and life and everything else, checking emails, but being present and being outside for 30 minutes a day was just the same as taking SSRI. Like, so there is a lot of power in holistic approaches. It's just sometimes, like for me anyways, it's like, oh, my anxiety gets in the way. So it's like, oh, I don't got time to go sit outside for 30 minutes and just not do anything. But sometimes you just need to make that time. You need to schedule that, put it in your calendar. Sometimes I like just go out and I'll just sit in my hot tub and put my noise canceling headphones on, right? And check out and just kind of really just kind of be with my thoughts. But if you guys can get outside, trying some of these holistic approaches and incorporating them into your depression routine, your mental health daily routine. This is all maintenance. Not one thing is going to be your saving grace. It's trying each one of these things and in a combination of them with maybe more yoga, less SSRI. Whatever works best for you, but you got to get out there and try it. And that's where resiliency comes in. And hopefully this episode gives you guys some resiliency to our viewers and listeners and get you guys some tools and tips to go out there and try. Moving on to just the last kind of thing I want to kind of address here. When we talk about inpatient versus outpatient, treatment, because, this is always a topic I like to kind of discuss if I have the opportunity, because at least for me, when I was really struggling, I always told myself that, hey, if things get so bad, I can always check myself in. Right. I could always go get help. I could always go to a mental health hospital or behavioral hospital or an ER and really say, hey, I need help. I think both of us have gone through inpatient treatment for, our respective diseases or, injuries, however you want to look at them. For me, it was post-suicide attempt. I tried it in my life and I got transferred to a behavioral health center. I spent about 10 days there. And, I will tell you, that's where I started getting on my meds for the first time. But all of those meds got adjusted when I got out because I got with a better clinician and a better physician. But what is your, first off, let's talk about the differences between inpatient versus outpatient, Bryan. Have you had experience with both? Because mine was only inpatient. I didn't have any outpatient experience.
Yeah, I've had experience with outpatient. And that's essentially where you're going to the same facility on a daily basis, as opposed to spending the night there and being in there full time, and going through therapy, a lot of group therapy with other patients. And inpatient is something that you utilize when you get to that point that you're starting to, really get to the end of your rope. And unfortunately, as we talked about earlier, a lot of people in our profession, a lot of first responders do end up taking their own life. And it's that step you take when those thoughts start to occur to you. When that really becomes a reality, a true threat to yourself, that's when you need to seek that kind of help. And for me, I think one of the most profound effects it had for me was just giving me perspective. Being inside of that facility, and there's not a lot to do besides the therapy, and then a lot of time to reflect. And you know, before going in there, I was under the influence of alcohol heavily, and my mind just wasn't in the right place. And being in there, kind of sobering up and realizing, you know, hey, what just happened and what I tried to do. This it speaks to you very loudly, and it's not necessarily the most pleasant experience. You know, you're not going to a 5-star club or anything like that. But
No, it's not a resort you're going to. Don't think it's going to be like the Palms or something.
Yeah, yeah. Unless you live in Hollywood or something. Now it's no, it's not the most pleasant experience necessarily, but I think it does give you a lot of perspective on life and on what's important. And you know, it saved my life. I think it did the same thing for you. I hope that I never have to be in that situation again where I need to be, you know, put into an inpatient facility. But it did help me for sure. And then the outpatient therapy is great too. Sometimes that group therapy, even though you don't really know these people, it's just good to hear other people talk about going through the same types of struggles that you are, so that you know that you're not alone. There's other people out there going through the same thing.
I got a lot of the out of the peer support groups. You know, I would encourage people to try to find, especially first responders, you know, try to find, you know, should you have to utilize that resource. You know, for me, it wasn't really, I was not given a choice. It was, hey, you're going here. You know, there are places and facilities out there that more or less tailor to first responders and what they bring to the table. I would wholly ask and encourage you to maybe look at some of those options beforehand, especially if you feel like you're suffering. You know, it's always nice to have plan A through Z. You know, you hope you never have to use Z, but if Z has already been thought about, talked about, discussed, and you have a plan, you're more apt to pull that ripcord, I would say, and utilize that tool versus picking up a gun or a knife or, you know, any other means to hurt yourself and harm yourself, you know, because we want to see all of you, you know, next year on the next episode. You know, nobody wants to get to that point. Trust me, you know, I've been to that very exact point where you make that decision. And that's a place I never want to go back to. I will say that the facility that I went to, I did not have the best experience that I could have had I gone to a program that was more centered around first responders and maybe veterans or something like that. Not that I'm a veteran, I'm a former DoD contractor, but you know, I found that the one that I went to was more tailored towards, you know, your general public, and really it was a detox facility. Because I was the only one in there with a mental health issue. Everybody else was in there for, you know, withdrawals of some sort, some substance. And for me, that was a very triggering experience because you're basically putting me back in places where I remember some of those calls. I've had some of those patients, not these people that I was with. But what I was able to draw from was, you know, finding some tools, and we can get any good out of anything, and just a lot of self-reflection of where I am, where I am currently, trying to clear up the fog, so to speak. What is my next step? I don't know, you know. And, you know, they kind of got me on my meds for the first time. Like, this is the first time I got on SSRIs. This is the first time I really kind of got on pharmacological treatment, because up until then, I told myself I didn't need it. I was the best therapist ever, right? My own. And I had alcohol. And that was my best therapist partner. And ultimately, it just kind of steered me down a wrong path. So, but I will tell you that getting out of there, it gave me a lot of tips, tricks, fuel for my fire to continue to carry on to others. So, you know, I would just encourage, you know, we hope we never get to that point. But if you're someone who kind of feels like, you know, you're in this treatment, you know, resistant depression, you know, it's just like finding a therapist. It doesn't hurt, right? It doesn't hurt to have an actionable plan already thought about beforehand, because when you get in that crisis, especially for those who might be in that point right now, just understand, like, I know what that feels like. And it's really hard to kind of see through the fog when you got so much fog around you. So, having a pre-planned map, kind of, something like that, it is helpful. And, it does get you to the place that you most likely will have some success, because that's what we want. We want to go to these places. And initially I thought of it as shame, right? Like when I got committed for 10 days, I looked at it as shameful, embarrassing, all sorts of stuff. And now I'm able to look back at like, I needed that. I needed that to be here in front of all of you guys today, because if I didn't have that, I know what the other option would have been. And I still do. So it is something to really kind of consider and think about. But that kind of brings us to crisis intervention and thinking about like addressing things like acute depression in first responders. Bryan, that's sometimes that just comes on hard, fast, out of nowhere. It totally, just like you mentioned, it's debilitating. It's hell. It really is a hell on earth. What are some things that you do when you're in crisis? And obviously your crisis is going to be different from other people's crisis. So maybe elaborate a little bit about that. For me, a crisis is like, I'm having a really bad day. My tools aren't working. I'm overwhelmed. I'm stressed out. My cup's empty. And that's even now. That's even, days like this morning. I had a really off morning, but I'm utilizing my tools and getting myself back on track. But, what is a crisis for you?
When I'm in crisis mode, like you said, that's when you're having a day or maybe even a week, however long it is, that your tools just aren't working, and you're starting to have some of those intrusive thoughts, and very negative feelings, negative thoughts. And for me, that's when I lean heavily on my family and my support system. I have friends who are very aware of my mental health past and what I go through, and I lean on those people, and those people are extremely helpful in my life. And that's what I encourage everybody to do is have a support system, have somebody that you can call when you hit that point, that can kind of talk you down a little bit. Of course, now anytime that if that were to happen, I would go to my provider right away. And my provider is very good about, getting me in immediately if I need it. That's kind of what I do if I ever reach crisis mode. To be honest, since I started the ketamine therapy, crisis mode is pretty rare.
Isn't that funny, huh?
Yeah, pretty rare. Doesn't happen real often since I started that therapy. So,
yeah. And that's nice, man. It gives you a nice blanket, nice little security. And it's nice, for those of you out there who have experienced these crises, it's nice when you're not in them. Trust me, the less crisis days I have, the better, but this is where it goes back to your routines and the habits that you guys make for yourself, and if you don't work on your routine, I call it a mental health and wellness routine, and for me, every morning it's doing self-reflection. What are some things I'm grateful for? Doing my daily readings. From there, I like to get a workout in or do something physical if I can, because I got to take care of my body too. Got to sleep well. And then just working through all these things that I've talked about, staying on top of my meds, journaling, talking, getting out, making sure I'm connecting and not isolating. These are things that I have to practice every day as a routine to maintain and keep those crisis days at bay or as minimal as I possibly can. And they still come up. And this is what I want to share with our viewers and listeners too. You're going to have bad days. That's life. What I have found in my resiliency in battling depression and suicidal ideations is really just the ability to realize how fucking tough I am. And I hate to say that. It's not my ego. It's just, I'm still here. I'm still doing it. I'm still working it. And that's important, because that drive is what has kept me alive, I would say. There's going to be bad days. You're going to have rough ones. They're going to come and go. They're going to vary in amplitude. But if you're not working on yourself, if you don't have some of these things already in your toolbox and you're not working towards them and growing, it's just like with everything else. If you're a law enforcement officer and you don't go out on any, warrants after a couple of months, or years, and then getting right back in the saddle, you're going to be off. Like, this is stuff that you have to incorporate at least to some degree, try to do it as daily as possible, but to overcome depression and really kind of get through it. Like, if you talk to a lot of the people that knew me, and maybe some of you viewers and listeners can see it, I don't know. Sometimes it's really hard, like Bryan said, to see it in ourselves. But at least for me, I've had a lot of people outside of my circle notice, more recently, I went to EMS World, and I had someone approach me that had seen me at some other conferences in years past. And, I was that hurt alcoholic, drunk, trying to mask everything with alcohol and really, really struggling. And they got to see me in a different light. And, it was refreshing, not only to have that individual, take the time and energy to come up to me and approach me, because I had made my safe space. I've shared my stories many times, but, to really, for me, it was nice to see that other people could see the changes that sometimes are hard for me to see, because sometimes in those days, this is why I love doing buddy checks and things like that. You never know who might be having a crisis day or a crisis moment, but if we have the ability to make an impact or help them, guide them out of that, I think it's on us to save ourselves as first responders, whether you're a nurse, a physician, corrections officer, firefighter, wildland, if we don't help each other, check in on each other, provide some of these resiliency tools, have these discussions, talk about, hey, Bryan, what worked for you? I want to maybe learn from that. I'm not going to say what works for Bryan is going to work for me, but maybe he's done some things that I haven't tried yet that I want to now go and try and practice. And so, what are a couple of key points, Bryan, at least for you and your recovery story, that you'd like to share with our listeners or viewers?
The main point that I want to make is to be aware of your mental health and take care of it. Treat it just like you would treat your body. You've got to take care of your brain too. You've got to take care of your mind. And if you're having trouble and you're struggling, don't be afraid to reach out and ask somebody for help. Seek out a provider and get treatment. And also, like we spoke about earlier, do things that are going to have a positive impact on your day, on your life. Get outside, get some exercise, spend time with your family, do things that make you happy, and don't neglect those things. Those things are very important. Spending time with your family and your friends, and you got to do things that are not just work. So many people that I know in our profession just work all the time. And you've got to give yourself some downtime. You got to get plenty of sleep. That's a big thing. Don't neglect your sleep. Make sure that you're, if you find yourself one of those people who are just an insomniac and you're never sleeping, you're always up all night on your phone, put your phone down, turn it off, get some sleep, pop a couple melatonin, whatever you need to do, get some good, natural, healthy sleep, and take care of yourself. It's the best advice I can give. And that's easier said than done. It can be difficult to do when you're in that depression phase. It can be very difficult, but it all starts by reaching out to somebody and letting them know, hey, this is what's happening. This is what's going on.
Yeah, you got to ask for help. And it takes us, and I can I'm not the best at it. I don't think you ever are. There's nobody that has that answer, but I can kind of pick up when someone might be having a tough day or a little bit of a rough time or a rough patch, and I try to be observant and aware of that perspective. And I try to lend a graceful hand or an empathetic, text, whatever it might be, to help lift them up, to give them back on their feet, or at least going and giving them a little bit of energy, filling their cup a little bit to keep them going and moving in the right direction. Bryan, I just want to thank you again for your time, your energy, your thoughts, being raw and candid and transparent in this conversation as we talk about, how to deal with depression and some of the treatment options here. I really appreciate that. For all you listeners and viewers out there, if you guys found today's discussion enlightening and want to stay connected with our ongoing mission, be sure to subscribe to this episode, subscribe to our podcast, YouTube channel. You can find a bunch of resources online at www.mindthefrontline. As we wrap up another enlightening episode of Critical Conversations, we want to extend our heartfelt gratitude to Bryan for sharing his valuable experience with battling depression, where he is now, his success story, and his resiliency, really, and all the little tips and tricks that he shared. These are things that you can each take hopefully something away, incorporate it. If you're suffering from depression, I wholly invite you to find some resources, reach out, connect with somebody, and just share how you're doing. Hey, I'm not okay. And it's fine. It's okay to say that. Just know that the stigma and the fear are always going to be there. They're always going to be prevalent, but you got to speak up. We can't help those in silence unless we know they're suffering. And for those out there that are feeling great and they got the energy and they got the space, more importantly, if you're able to, try to reach out and brighten someone else's day. To our dedicated listeners, thank you again for joining us on this critical journey. Your support makes the impact of these conversations resonate even further. Let us know your thoughts by leaving a review and also leaving a comment down below. Until next time, take care, stay strong, and mind the front. To our dedicated listeners, thank you again for joining us on this critical journey. Remember, the Critical Conversations podcast is a steadfast resource for police, fire, EMS, allied healthcare workers, dispatchers, air medical, and military personnel, along with their families. Your support makes the impact of these conversations resonate even further. If you found today's discussion enlightening and want to stay connected with our ongoing mission, please be sure to subscribe to the Critical Conversations podcast. You can find us via Spotify, Apple Podcasts, YouTube, and the Mind the Frontline website. Your subscription ensures that you will never miss an episode, and it's a powerful way to show your commitment to fostering resilience within the entire first responder community. For more information and additional resources, visit our website at www.mindthefrontline.org. Together, let's continue these critical conversations and build a stronger, more resilient first responder family. We thank you for being a part of the Critical Conversations podcast. Until next time, take care, stay strong, and mind the front line.